Hey everyone, welcome. This is 3.0 of the Blueprint Outlines, and this is on sterile and non-sterile compounding. Sterile is USP 797, non-sterile is USP 795. Alright, so the definition of compounding. Compounding is the creation of a pharmaceutical preparation. It's a drug by a licensed pharmacist to meet the unique needs of an individual patient, either human or animal. There are veterinary compounding drugs that compounding pharmacies will compound or make. And it's when a commercially available drug does not meet those needs. A patient may not be able to tolerate the commercially available drug, and the exact preparation needed may not be commercially available. Or a patient may require a drug that is currently in shortage, or maybe it's discontinued by the manufacturer, and so they would go to a compounding pharmacy to meet their needs with getting the medication that they need. The U.S. Pharmacopoeia, USP, convention formally defines compounding as the preparation, mixing, assembling, altering, packaging, and labeling of a drug delivery device, or a device in accordance with the licensed practitioner's prescription, medication order, or initiative based on the practitioner, patient, pharmacist compounder relationship in the course of professional practice. So that's your general definition of compounding. 3.1, infection control like hand washing and PPE, personal protective equipment. So there are basic practices to limit infection control with handling drugs for dispensing to the patient. Hand washing and PPE and aseptic technique. PPE and aseptic technique. Write that in or type that in, are among them. By the way, earlier when I was talking about definition of compounding, where I said compounding is the creation of a pharmaceutical preparation. I forgot to tell you guys to write that in. So compounding is the creation of a pharmaceutical preparation. Okay, let's go back to 3.1a. So again, there are basic practices to limit infection control with handling drugs for dispensing to the patient. That is hand washing, PPE or personal protective equipment, and aseptic technique or sterile technique. B, hand washing. Hand washing is very important, as we all know, in infection control and one of the easiest processes to avoid contamination of drugs. Always wash hands before and after handling drugs with an antibacterial soap. Let's go to page 2. So C, personal protective equipment or PPE, the definition. PPE is defined by the Occupational Safety and Health Administration, or OSHA, as specialized clothing or equipment worn by an employee for protection against infectious materials. PPE is very important in preventing the transmission of disease to pharmacy personnel and patients. 1, it includes gloves, latex and non-latex, because some people, if you remember, are allergic to latex, gowns, shoe covers, goggles, hair covers, masks and respirators, and face shields. 2, 3 things to consider for PPE. The type of anticipated exposure, and this is determined by the type of anticipated exposure such as touch, splashes, sprays, or small, large volume of toxic chemicals or fluids, which are like cytotoxic drugs that might penetrate clothing. Also, the durability and appropriateness of the PPE task, and this will affect, for example, whether a gown or apron selected for PPE, or if a gown is selected, whether it needs to be fluid resistant, if you're getting a lot of splashes, fluid proof, or neither. The last is proper fit. So this especially includes the proper size of protective gloves, latex and non-latex. 3, gloves. Gloves used are made of either vinyl, latex, or nitrile, which is synthetic. People who are allergic to latex, obviously they'll use either vinyl or nitrile gloves. Some individuals have a latex allergy and should use the other options of gloves available. A, change gloves as often as needed. B, it is also good practice to use double gloving, when dealing with cytotoxic drugs such as chemo drugs. And this is usually when you're working in a vertical or biological safety cabinet, a vertical laminar flow hood, or a biological safety cabinet, which is also a vertical flow hood. For 4 key points to remember about PPE. Use non-PPE before you enter the laminar flow hood, page 3 at the top. Use it carefully to prevent contamination. For instance, don't take your glove hands out of the hood to correct your glasses or scratch your nose or whatever. And once your task is completed, carefully remove the PPE and discard it in the receptacles provided. If you're dealing with cytotoxic drugs, such as chemotherapeutic drugs, cancer drugs, a biohazard receptacle should be provided. And immediately perform hand washing. 5, the sequence. This is important. The sequence for removing PPE, and that is gloves, face shield or goggles, the gown, the mask, and then the shoe covers are last. All the other ones you throw away. You can reuse the gowns. You just turn it inside out and just hang it up on a coat hanger. But usually you want to discard your gown at the end of a shift and then use a new one for your next shift. Work practice controls, D. One of the most important practices when working under the hood is to not recap needles. So one of the things that we do if we have the needle that's in the workbench under the laminar flow hood is once we take the cap off and we turn it or screw it onto the lure lock part of the syringe, at the end of our work or at the end if you're going to take a break or whatever, you do not recap the needle, okay? You just put everything into a sharps container that should be inside the workbench area. 2, when working with aseptic technique under a laminar flow hood, always work at least 6 inches. 6 inches in the hood from the edge of the workbench table. Know this for the exam. It's a common question. They ask you how many inches should you be working inside the laminar flow hood from the edge, and it's always going to be 6 inches. 6 inches from the edge. 3.2, handling and disposal requirements, receptacles, and waste stream. So a waste stream is a term to describe the entire life cycle of the garbage we produce. In pharmacies, we must have a process to minimize waste that enters the environment, especially if it is toxic waste. There has to be a complete flow of waste from the pharmacy to its final disposal. Page 4 at the top. B, receptacles are they're just waste containers. They can be biohazard or non-biohazard. So these would include biohazard waste bins or bags, sharps containers for needles and syringes, and regular waste bins and bags for non-toxic waste. So you basically have 3 or 4 different kinds of waste that you have to deal with on a daily basis. Now, 3.3, documentation. For instance, these are batch preparation, the compounding record, etc. A, compounding records contain information about the medications that were dispensed to a particular patient. And as such, they are considered a part of the patient's medical record. Compounding records should be retained in accordance with the pharmacy's medical record retention policies. It is a primary document a pharmacy uses to determine which preparations contain a particular lot number of ingredients in case of a drug recall. So every ingredient that you use should have both active and inactive ingredients should have a lot number, and it should be recorded in the compounding record. As such, compounding records should be readily retrievable and readily available, and these can be maintained on paper or it can be computerized and kept in the computer. B, batch preparation compounding is the compounding of multiple sterile or non-sterile preparation units in a single discrete process by the same individual carried out during one limited time period. So one individual will go in there, if it's a pharmacy tech, and they'll do batch preparation compounding. And so we only want one individual so we don't get confused and so we can better track the compounding record when there's only one individual. C, documentation is required in order to meet quality assurance. Please type that in and write it in. Quality assurance. Assurance is ASSURANCE. Documentation is required in order to meet quality assurance guidelines. So compounded products are prepared on an individual basis to meet the special needs of a patient or patient population. The pharmacy must have a good quality assurance program and maintain proper records to ensure that patients are receiving safe, stable, and properly compounded medications. These procedures are used to meet certain specifications, standards, and controls. Let's go up to the top of page 5. 3.4. Determine product stability, for instance, the beyond use stating, BUD, signs of incompatibility. So those are examples. A. Active pharmaceutical ingredient, or API, or AI, active ingredient. This is any substance or mixture of substances intended to be used in the compounding of a drug, of a drug preparation, thereby becoming the active ingredient. Write that in, or type it in, active ingredient. So thereby becoming the active ingredient in that preparation and furnishing the wanted pharmacologic activity or other direct effects in the diagnosis, cure, mitigation, treatment, or prevention of disease in humans and animals, or affecting the structure and function of the body. So tip, know what AI means, which means active ingredient. B, the stability of a product is the extent to which a preparation retains within specified limits and throughout its period of storage and use the same properties and characteristics that it possessed at the time of compounding. C, beyond use stating. This is BUD, beyond use stating. So this is the date after which a compounded preparation should not be used. It's determined from the date the preparation is compounded. Determined from the date the preparation is compounded. We do not use, the default is not the default to use the expiration date that's on the manufacturer's bulk bottle. It's determined by different methods, and it's determined from the date that we actually compound the compounding medication. D, instability and incompatibility. 1, instability. Okay, so this is defined as a phenomenon which occurs when an LVP, or large volume parenteral, or LVP drug product, such as an IV admixture, is modified due to storage conditions such as time, light, temperature, absorption. An unsuitable product may be formed as a result, and this is the result of instability. 2, incompatibility is defined as a phenomenon which occurs when one drug is mixed with others and produces an unsuitable product by some physiochemical means. The new product is definitely unsuitable for administration to the patient because the active drug, for whatever reason, has been modified, such as, for example, an increase in toxicity, or because some physical damage, such as maybe the solubility, was affected or has occurred. Okay, page 6 at the top. We're doing great, you guys. A, if there is incompatibility in an IV bag, such as an LVP, large volume, or IVPB, which is intravenous piggyback, a precipitate will form. You'll see a precipitate which usually develops in the bag. This is usually represented by a white cloudy substance that forms in the bag. So if you see a white cloudy substance in the bag, somehow then it's gotten contaminated, and you most likely have some kind of precipitate in the bag. And so when this occurs, you can't use the bag. You've got to toss it out. IV piggyback, again, if you remember, those are smaller bags, usually 50 ml to 100 ml, and it has like one drug in there. Usually it could be an antibiotic, but that's one drug. We stick it into an IV piggyback, and then that line is then merged into the main line with the large volume parenteral. 3.5, selection and use of equipment and supplies. A, basic equipment and supplies used in compounding are varied depending on use and whether the compounding of the preparation is non-sterile or sterile. 1, non-sterile compounding. You need a balance for measuring ingredients, and it can be either digital, electronic, or it could be a manual one. Most compounding pharmacies have digital scales because it's quicker. And beakers, you have to have different size beakers for measuring ingredients and for mixing or heating ingredients. You can have capsule filling equipment for preparing capsules. You can have a chopper or grinder for breaking up solids or ingredients of large particle size. And you could have electronic mortar and pestle. You saw a picture of an electronic mortar and pestle in the PowerPoint lectures. And this is for mixing creams and ointments or for reducing particle size. Filter paper for removing particulate matter from a liquid. Funnels for transferring liquids and powders and also for filtering. Graduates for measuring liquids. Remember we have plastic and glass graduated cylinders. Homogenizer, and so these are for reducing particle size and evenly suspending liquids. Hot plates for melting bases. A magnetic stir plate for continuous stirring. Magnetic stirrers for continuous stirring. Molds for making trochees and suppositories, and manual mortars and pestles. Number 7, page 7. And glass for liquids, wedgewood for powders, and porcelain for powders. So I'm talking about the different kinds of mortars and pestles. So there is glass mortar and pestle, again used for liquids. There is wedgewood, which is often used for powders, and then there's porcelain mortar and pestles, which is used for powders. Please know this, the different types. The question on the exam may say, which one of the following types of mortar and pestles would be used for liquids? And so the answer would be glass. Or which one is for powders? The answer would be either porcelain or wedgewood. You can also, you may need an ointment tile for making creams and ointments. And then a refrigerator. A refrigerator is mandatory. You have to have a refrigerator for any kind of pharmacy. But this is for storing ingredients and prescriptions that require cold temperatures. Safety glasses. Safety glasses are always good. You don't want to get some cytotoxic chemical into your eyes. Spatulas for mixing creams and ointments and for retrieving chemicals from bottles. So there are stainless steel spatulas, there's wooden spatulas, there's plastic spatulas. Stirring rods are usually glass for stirring liquids by hand. Strainers for removing particulates from a liquid. Thermometers for controlling and checking temperature. Tongs for picking up items that should not be handled. Tubes for dispensing creams and ointments. Weight boats or papers. These are for weighing ingredients on a balance. So they're like little containers. They're usually made of plastic. And so you would put them on the weighing tray of the balance, so because you don't want to contaminate the weight of the weighing tray. And then weights for calibration. So if you have a manual, balance, then you're going to be using weights for calibration. Sterile compounding, 2. So with sterile compounding, we are going to use a laminar flow hood. It's designed to reduce the risk of airborne contamination during the preparation of IV admixtures by providing an ultra-clean environment. HEPA, high efficiency particulate air filter, is used in a laminar flow hood to remove bacteria that enters the hood during preparation of IV admixtures. Please know what HEPA stands for. You could be tested on that on the exam. Again, HEPA stands for high efficiency particulate air. So these are filters that are inside of a laminar flow hood, both horizontal and vertical in biological safety cabinets. The 3 functions of the laminar flow hood. The first, of course, is to provide clean air in the working area. The second is to provide constant flow of air out of the laminar flow hood, which prevents room air from entering the work area. Page 8. C, above. Third is the air flowing out, suspends and removes contaminants introduced into the work area by materials such as IV bags, syringes, or drug packaging, or personnel. Hopefully you're not bringing a lot of contaminants into the work area. Items that are prepared in a laminar flow hood. Well, of course, IV admixtures or parenterals. Ophthalmic solutions, because ophthalmic solutions should be sterile. reconstitution of powdered drugs, filling of unit dose syringes, and miscellaneous sterile products. Laminar flow hoods are usually kept running continuously. You always just keep them running. If they are shut off, it is recommended that it be run for at least 30 minutes. Know this fact. It is often asked on the PTCE. So, it is recommended that if you turn off a laminar flow hood, that when you turn it on, you leave it on for at least 30 minutes before you resume working under the hood. Laminar flow hood should be inspected and certified every 6 months. Again, another fact you have to know for the exam. Laminar flow hoods should be inspected and certified every 6 months to ensure that the HEPA filter is intact, unclogged, and has no holes in it. Again, know this fact. Laminar flow hoods come in horizontal airflow, horizontal from back to front, and vertical airflow. And the airflow in a vertical comes from top to bottom. So, laminar flow hood is from the back of the hood to the front. Vertical flow hood is from the top to the bottom, to the workbench. Horizontal airflow is usually used for non-toxic preparation of drugs, while vertical is used for toxic preparations like chemotherapy drugs. And we go a step further now. You can still compound chemotherapeutic drugs in a regular vertical laminar flow hood, but today most hospitals just employ a biological safety cabinet, which is a fancier vertical flow hood. Okay, so and speaking of biological safety cabinets, so these are special vertical laminar flow hoods used to provide protection for the worker, the work environment, and the drug. C, needles. Needles consist of two parts, the shaft, and the hub. The hub is the part that is screwed into a luer lock syringe. Now, the shaft is a long, slender stem of the needle that is beveled. If you see the tip of the needle here, which is pretty sharp, you'll see that it's beveled. It comes down at a 45-degree angle. Can you guys see that? Okay. So the bevel is the cut end of the needle. So it has the hole here, right? And the lumen is the hollow bore of the needle shaft. So the lumen is the actual hole here. That's the lumen. So it has a diameter to it. Page 9. The hub is the other end of the needle to which a syringe can be attached. So this one is a luer lock, so you would screw it onto a luer lock type syringe. And then there's also slip tip needles, you just slip them on. The needle size is designated by length and gauge. The length is measured in inches, so this looks like an 1.5-inch needle. So it's measured in inches, while the gauge is used to designate the size of the lumen, or the size of the hole, which is at the tip of the needle. Now remember this, you learned this in the PowerPoint slides, the larger the number, the smaller the lumen. For instance, a 22 gauge needle has a smaller bore, or smaller diameter or lumen than an 18 gauge needle. Know that for the exam. They're going to say which one of the following needles has the smallest bore, or the smallest diameter, or the smallest lumen. It's all saying the same thing. 18 gauge, 19 gauge, 22 gauge, and of course if it says smallest, then 22 gauge would be the answer, right? The bigger the number, the smaller the lumen or diameter or hole or bore. Syringes. I wish I had a syringe here, but I don't. The two basic parts of a syringe are the barrel and the plunger. You've seen this, we cover it extensively in the PowerPoint lectures. The barrel is a tube that is open at one end and tapers into a hollow tip at the other end. The open end is extended radially outward to form a rim or flange to prevent the barrel from slipping through the fingers during manipulation. So let's say this is a syringe, this would be the barrel, and the plunger would be up here, would go inside the barrel. So the plunger is a piston-type rod with a slightly cone-shaped tip that passes inside the barrel of the syringe. The other end of the plunger is shaped into a fat knob for easy manipulation, and the plunger must be able to move freely throughout the barrel. Yet its surface must be close to the barrel that the fluid cannot pass in between, even when under considerable pressure. The tip provides the point of attachment for a needle, And there are two types of tips. The slip tip, which I talked about earlier, which allows the needle hub to just slip right onto the syringe tip. And then lure lock. Lure lock is actually a patented device that's owned by BD, Becton Dickinson. So what this does is this locks the needle onto the tip by twisting until it's secure. So here is a lure lock on the needle hub. Know the difference between the slip tip and the lure lock. Syringes are disposable and have a capacity range of 0.5 to 60 mLs. 0.5 is a half an ml. So a half an ml to 60 ml. 60 mLs is how many ounces, guys? 2, right? 2 ounces, because 1 ounce is 30 mLs. So it can go anywhere from half a mil to 2 ounces. And then you'll see graduated lines. Graduation lines are usually in milliliters in syringes. And then you have specialty syringes like insulin and TB syringes. Next page, page 10. Number E, IV bags. So these are plastic bags, usually polyvinyl chloride. They're used for dilution of a solution and are the most common containers used in administering IV medications to patients. Plastic bags are available in many different sizes with 50 ml, 100 ml, and 250 ml designated as small volume parenterals, SVP. And then 500 and 1,000 mLs are designed as large volume parenterals, or designated as large volume parenterals. Special bags for compounding parenteral nutrition, otherwise known as hyperalimentation, hyperals, are also available in 2,000 and 3,000 milliliter sizes. How many liters is 2,000? Do you remember? It's 1 liter, right? Because 1 liter is equal to 1,000 milliliters. So 2,000 milliliters is 2 liters, and 3,000 milliliters is 3 liters. Most bags are made of PVC. However, there are non-PVC bags which are used for specific drugs such as Taxol because it can react with the polyvinyl chloride in the bag. Okay, 3.6. Let's talk about sterile compounding. This is governed by USP 797. All pharmacies effective last year had to meet the USP 797 guidelines. So if you're a compounding pharmacy, you had to meet the 797 guidelines, otherwise you'd have to close down for business. A. Sterile compound processes encompass what we have discussed already in the outline above. It utilizes aseptic or sterile technique, equipment and supplies, policies and procedures, safety such as PPE, and pharmaceutical calculations that must be accurate. We will cover pharmaceutical calculations in a separate and special section, but let's go into detail about what USP 797 is and what it is not. So, B, USP 797 terminology. 1, the anti-area. So this is referring to a aseptic technique pharmacy that's going to make sterile compounding, preparing IV parenteral bags. And so they have a separate area in their pharmacy. So the ante-area is an area in which all preparations for IV admixtures are gathered, including labels, gowning, and drug materials. BUD is the beyond use dating. Write that in or type it in. Beyond use dating. This is the date or time a drug or material can no longer be used. And the date is ineffective. The drug is ineffective after this date. Beyond use dating, or BUD. The buffer area. So this is an area in which hoods are kept and IV preparations take place. So when you go into an IV pharmacy, you're going to go into an ante area, and then it has its own little area. The ante area is usually where you gown up and wash your hands and stuff. And then there'll be another door enclosed and isolated. When you open that door, then you enter the buffer area. The clean area is a space where microbial containment is kept at a specific level of safety to ensure a certain level of cleanliness. Let's go to page 11. Number 5 is compounding sterile products. So, this is also known as CSP. Know what CSP stands for, compounded sterile products. Compounded sterile products is a sterile drug product, including radiopharmaceuticals, which is compounded in a nuclear pharmacy. It's a highly specialized type of pharmacy. That was prepared for compounding or underwent other handling or manipulation prior to administration. So a compounded sterile product is a product that utilizes aseptic technique. 6 is the critical site. This is an area exposed to air or touch, such as a vial, needle, ampule, etc. Okay, we're still in terminology of 797. Direct compounding area. This is a critical area within an ISO class 5 area. That would usually be like inside of a laminar flow hood. 8, the media fill test. This is a test performed on a compounded product to ensure no contamination has occurred during the preparation phase. So we're basically, when you do a media fill test, you're testing for sterility. 9, negative pressure room. This is a room in which air flows into the room and away from adjacent rooms, which results in a positive pressure in the room. 10, positive pressure room. So this is a room in which airflow out of or toward the adjacent rooms, which results in a lower pressure in the room. Number 11, ISO class 5, formerly known as class 100 area. This is an area where there are no more than 100 particles, 0.5 microns or larger per cubic foot of air. That's the definition of ISO class 5. In the ISO class 7, formerly known as class 10,000 area, it's an area where there are no more than 10,000 particles at 0.5 micron or larger per cubic foot of air. And then in ISO class 9, formerly known as class 100,000 area, this is an area where there are no more than 100,000 particles, 0.5 micron or larger per cubic foot of air. Okay, C. USP 797. We just went through the terminology. Now we're going to dive a little bit deeper. 1. Responsibility of compounding personnel. The compounding personnel must be adequately skilled, educated, instructed, and trained. Ingredients must have the correct identity, quality, and purity. And opened or partially used packages must be properly stored and under restricted access conditions. All right, let's go to page 12 on the top. D, water containing CSP, right? Do you guys remember what CSP is? So compounded sterile products that are non-sterile during any phase of compounding must be sterilized within 6 hours after completing the preparation. E, measuring, mixing, sterilizing, and purifying devices are clean, appropriately accurate, and effective for their use. F, packaging selected CSP is appropriate to preserve the sterility and strength until the beyond use dating. G, compounding environment maintains sterility or pre-sterilization purity. H, labels on CSPs list the names and amounts or concentrations of active ingredients. I, labeling of injections lists the names and amounts of concentrations of all ingredients. J, before dispensing or administering CSPs, the clearness of the solution is visually confirmed. You have to look to see if it's clear. B, BUDs are assigned based on testing and obtaining information from reliable literature sources. Procedures for measuring, mixing, diluting, sterilizing, packaging, and labeling conform to quality established for the CSP. Okay, 2. Compounded sterile product, microbial contamination risk levels. These are the risk levels for CSPs. A, low risk. This is compounded within an ISO class 5 or better environment. The compounding involves the transfer, measuring, and mixing of not more than 3 packages of sterile products. There cannot be more than 2 ingredients entered into one sterile container. Sterile needles and syringes must be used to open disinfected ampules or vials, and the time from compounding and administering the CSP cannot exceed 48 hours at controlled room temperature. page 13, top. B, a medium risk situation. This is multiple individual or small doses of sterile products are combined to prepare a CSP that will be administered to multiple patients or to one patient on multiple occasions. The compounding process takes a long time to complete, and the time period from the completion of the compounding and administration cannot exceed 30 hours at controlled room temperature. C, high risk. Okay, high risk. This is the high risk level. Uses non-sterile ingredients not intended for sterile routes of administration. If the air quality is less than the International Organization for Standardization, or ISO Class 5, for 1 hour or longer, you have sterile contents of commercially manufactured products, CSPs that lack effective antimicrobial preservatives, sterile surfaces of devices and containers for the preparation, transfer, sterilization, and packaging of CSP. D, compounding personnel are not properly garbed. Non-sterile water containing compounds are stored for more than 6 hours before being sterilized. 3, personnel training. A, must be trained using videos and professional publications. So if you're one of these pharmacy technicians that want to go work for a hospital or an inpatient setting, every one of these pharmacies have their own training, video training usually, and slides to teach their aseptic technique. Coursework must include both didactic and clinical content, and they must pass a written and media fill tests. 4, immediate CSP. This is intended only for emergency or immediate patient administration of CSP. 5, single and multi-dose containers. Single-dose vials, or SDV, containers must be used within 1 hour of being opened. Single-dose containers must be used within 1 hour of being opened. Multiple-dose vials, or MDV, containers have a beyond use dating of 28 days. Multiple-dose vials have preservatives in them so that they can keep for longer, whereas single-dose vials are preservative-free. Number 6, hazardous drugs, page 14. So, A, it should only be prepared for administration under conditions that protect the healthcare worker. 7, environmental quality and control. A, personal requirements, which is training and competency. The training must be documented before the individual compounds a sterile preparation. Personnel must complete didactic training, pass the written competency assessments, and undergo skills assessment and media fill tests. On cleaning and disinfecting the compounding area, personnel cleansing and garbing, and then again the sequence of garbing. We talked about taking off the garb, now we're talking about putting it on. So the sequence of garbing is donning of dedicated shoe covers. Remember, that was the last thing that came off when you left the area. Then you have head and facial covers, the face mask, non-shedding gown, and then finally the last thing you put on is the sterile powder-free gloves. Standard operating procedure, number 8. Type that in or fill it in. SOP stands for Standard Operating Procedure. I'll give you a second. A, access to buffer area is restricted to qualified personnel. Carton supplies are decontaminated by using a spray disinfectant. Supplies that are not used frequently are stored in an anteroom. Carts used in bringing supplies from the storeroom cannot be rolled past the anteroom. Supplies must be disinfected and brought into the buffer room. And the non-essential supplies that shed particles should not be taken into the buffer area. Remember, that's the area where you have the hood. Traffic in and out of the buffer area is minimized, and individuals entering the buffer area should not wear outer garments such as coats, cosmetics, jewelry, or piercings. Page 15 at the top. We're on I. Proper attire. So proper attire should be worn into the anteroom. Hand and forearms should be washed with water and soap for at least 30 seconds. Again, know this rule. You must wash your hands and forearms for at least 30 seconds. It's a common question on the exam. Antiseptic hand cleansing must be performed before sterile gloves are donned. No food, drink, or chewing gum is permitted in the buffer or anteroom. M. At the beginning of the compounding session and whenever anything is spilled, the area is cleaned with USP purified water followed by a disinfectant. Usually it's ethyl or isopropyl alcohol, and it's usually 70% isopropyl or ethyl alcohol with a non-lint wipe. And a blower, if you turn off the laminar flow hood or you come in the morning and turn it on, the blower of the laminar flow hood must be on at least, ready? 30 minutes. Again, that was a fact that you had to know earlier. 30 minutes. Please type that in or write it in before working in the area. So a blower must be on at least 30 minutes before working in the area. O. Supplies in the direct compounding area, an area within the ISO class 5 where critical sites are exposed to unidirectional HEPA filtered air, are disinfected with 70% isopropyl alcohol or ethanol, ethyl alcohol. P. Supplies are arranged neatly in the DCA area, the direct compounding area. No object should be between the first air from a HEPA filter and the critical site. So for instance, if air in a horizontal laminar flow hood is coming from the back where the filter is to the front, and let's say that you have your vial, let's say this is the counter, and you have your vial here, you can't put another vial in front of it like that because the air that's coming from the back to the front, this vial that sits behind blocks the airflow to the vial that's in the front. So the best thing is just to make sure that they're apart so that the air from the back to the front can flow over each item or equipment that you have that's inside the workbench. And the supplies are neatly arranged in the DCA area. And Q, no object should be between the first air from a HEPA filter and the critical site, because that's what we talked about, just lost my place. R, procedures are performed to produce touch contamination, and gloves are disinfected with 70% isopropyl alcohol. So if you have a spray bottle, you just spray your gloves. All rubber stoppers of vials, bottles, and ampule necks should be wiped with 70% isopropyl alcohol for at least 10 seconds before preparing the CSP. So I just want to do that really quick here. Here's an ampule, the glass ampule. So the drug is inside. And so there's a proper way to deal with breaking the ampule. And so you want to get your alcohol swab and you open it. And you're on the workbench inside the laminar flow hood. And what you do is then you wipe the neck of the ampule. And then what you're going to do is you're going to cover the neck with the swab so that in case any glass breaks, you don't get cut. And then what you do is your thumb, like this, okay, you put your fingertips into the neck of the ampule and you just really quickly, you just snap really quick. You break it. And then you can withdraw or suck out the fluid, the drug, with the syringe. And if it's an ampule, you're going to use a needle, but it's going to be a filter needle in case there's any glass that broke inside of the ampule, and so the filter needle, this is not a filter needle, but the filter needle then will filter out any glass particles, because the last thing you want to do is to inject that into the patient. And then so the same thing with when you're in the hood, any kind of vials, all your equipment is in there along with all the supplies that you need to make your parenteral bag, your IV parenterals. These things snap off. So I'm going to snap off this little hood, and it's going to be on the counter. And you're going to, you have your latex gloves on, you're just going to snap it. And then with your alcohol swab, you always swab the top. Anything that you snap off, you're going to swab it with the alcohol swab before you take your syringe and needle and then poke it inside and withdraw the contents. Or if you're going to reconstitute, that's what you would do. Okay. So yeah, all rubber stoppers of vials, bottles, and ampule necks should be wiped with 70% isopropyl alcohol, or you can use the swab, for at least 10 seconds before preparing the CSP. Okay, D, sterile compounding equipment and procedures. Sterile compounding and administration equipment. A 70% isopropyl alcohol is used to clean the laminar flow hood surfaces, and we can also use ethyl alcohol. Next page, page 16 at the top. B, administration sets. So these are disposable sterile tubing that connects the IV solution to the injection site. Alcohol prep pads, such as what I just had earlier. These are used to clean the ports on an IV bag, the rubber stopper of a vial, or an area of the skin before an injection. Ambulatory pumps. These are small, lightweight, portable pumps worn by a patient that may be either therapy specific, like an insulin pump or pain control pump, or used for multiple therapies. Ampule breaker. This is the device used to break the neck of an ampule, just like we did, but you know what? Your fingers and thumb is perfect for that. I don't see why you would need an ampule breaker unless you're like really scared to break glass. Most of the time, using your hands, just like I do, with proper technique is sufficient. So ampules are elongated glass containers, right? There was the glass container. And I just poured the drug that was in there on my desk. So these are elongated glass containers in which the neck is broken off to gain access to the medication. Catheters. These are devices that are inserted into veins for direct access to the vascular system that may be either peripheral venous or central venous catheters. Clamps. These adjust the rate and shutting down of the flow of the IV. They include slide clamps, screw clamps, and roller clamps. The depth filter. This is a filter that flows by trapping particles as the solution moves through the channels. A drip chamber is a hollow chamber where drops of an IV solution accumulate that prevent air bubbles from entering the tubing. Filters. These are used to remove particulate material and microorganisms from the solution, and they can be attached to the end of a syringe, like a filter needle, the end of an administration set, or the end of the needle. Filter needles. These are needles that include a filter that prevents glass from entering the final solution where one draws from an ampule, for instance, like I was talking about earlier. A flexible bag, plastic container that may hold volumes ranging from 50 mLs to 3,000 mLs. And a heparin lock. So this is a short piece of tubing attached to a needle or a catheter when the tubing is filled with heparin to prevent potential clotting. Page 17. By the way, this is a really long lecture, so at any time you need to take a break, just stop the video, take a break, go get a drink, eat something, and then come back and just start it again. Okay, you control the pace of the lecture. O, infusion pumps. These regulate the flow of medication into a patient. P, large volume parenterals, or LVP. These are parenterals with a volume greater than 100 mLs, usually greater than 250 mLs. Q, male and female adapters. These fit a syringe on each end and are used in the mixing of two contents. R, membrane filters. These consist of small pores that retain particles that are larger than the pores. Membrane filters may be placed between the syringe and needle before medication is introduced into an LVP or a small volume parenteral. Mini bags. These contain volumes between 50 and 100 mLs. Multi-dose vials, again the MDV. This is a vial or container that can be used for more than one admixture that normally contains preservatives in it, so that's why you can use it multiple times. And contain a maximum dating, again, of 28 days unless otherwise specified by the manufacturer. Needles, composed of a hub and a shaft, and are designated by two numbers, the gauge and length. The gauge measures the diameter of the needle bore. The larger the gauge, the smaller the bore. Remember that? The larger the gauge, the smaller the bore. A 21 gauge needle is smaller than an 18 gauge needle. The length of the needle is measured in inches, like I said before, anywhere from ½ inch to 1.5 inches, usually. Piggyback. This is a small volume solution bag added to an LVP or large volume parenteral. Usually the piggyback will have one active ingredient, one active drug like an antibiotic. Single dose vials, these are a vial or container that can only be used once because they don't have a preservative. Small volume parenterals, SVPs, these are packaged products containing a volume of 100 mLs or less, so they're usually 50 or 100 mLs, that are either directly administered to the patient or added to another parenteral. Spike, this is a rigid, sharpened plastic piece that is inserted into the IV bag. And then syringe caps, so a syringe, this component includes a plunger. Components include a plunger flange, barrel, and tip. Syringe caps, this is a sterile cap used to prevent contamination of syringes during the transportation out of the pharmacy. Page 18 above. Syringe needles. Again, the components of a syringe needle is the hub, the shaft, the bevel, the lumen, and point. I showed that to you earlier, but it's also in the PowerPoint lectures. Transfer needles. So these are specially designed needles that look like two needles attached together at the hub that are used to transfer sterile solutions from one vial directly into another without the use of a syringe. Or it could be when you're transferring ingredients from one vial, a solution, into an empty bacteriostatic vial. Vials, they could be glass or plastic containers with rubber stoppers. Single-dose vials do not contain preservatives, but multi-dose vials do. Again, we reiterated that. 2. Laminar flow hood. Type A hoods, these recirculate a portion of the air after it passes through a HEPA filter within the hood and exhaust a portion of this air back into the parenteral room. Type B1 hoods, these expel most of the contaminated air through a duct to the outside atmosphere and also passes through a HEPA filter. Type B2 hoods, I said B1 hoods earlier. Type B2 hoods, these remove all the contaminated air to the outside atmosphere after it passes through a HEPA filter. The air is not recirculated within the hood or returned to the parenteral room atmosphere. Type B3 hoods, these use recycled air within the hood, and then all exhaust air is discharged to the outside atmosphere. A Type A hood may be converted to a Type B3 hood. Okay, 3. Intravenous solutions. Know all of these. Something that is a quarter normal saline. Remember, NS is normal saline. And if you remember, what is the strength of normal saline? 0.9% sodium chloride. Normal saline, again, is 0.9% sodium chloride. What is that by definition? 0.9% means 0.9 grams per 100 milliliters. That's weight volume. Okay, so a quarter normal saline is 1/4 normal saline, or 1/4 of 0.9%, or just take 0.25 and multiply it by 0.9, and you get 0.225% sodium chloride. That is the strength of quarter normal saline. That may be a question on the test. It'll say, what is the strength of quarter normal saline? Or what is the strength of half normal saline? You can't calculate it unless you know that normal saline is 0.9%. Half normal saline, this is 1/2 normal saline, or half of 0.9%. So half of 0.9 is 0.45. So half normal saline is 0.45% sodium chloride. D10W, that means dextrose 10% in water. D5W means dextrose 5% in water. D5NS means 5% dextrose in normal saline, which is 0.9%. So you kind of get it here, you can figure this out. D5, 1/2 normal saline, that would be dextrose 5% in 0.45% sodium chloride. Okay, I think you get it now. Lactated ringers is LR. Page 19. Normal saline again is 0.9%. SW is sterile water. If you see SWFI, which is, we call it SWIFI, SWFI, that stands for sterile water for injection. We usually use that to reconstitute lyophilized powders, use it to reconstitute other drugs. Okay, 4 types of injectable water. Purified USP water is not intended for parenteral administration. It's used in the reconstitution of oral products such as antibiotic suspensions. Water for injection is not sterile and cannot be used in septic compounding of sterile products. Bacteriostatic water for injection. This is sterile water with antimicrobial agents that can be used for injection. So whenever we reconstitute drugs under the hood, we are going to use bacteriostatic water. Sterile water for injection, otherwise known as SWIFI, has been sterilized but contains no antimicrobial agents and is used as an irrigating solution like for wounds. So you usually use sterile water to irrigate wounds. Okay, 5, aseptic technique or sterile technique. These are techniques used in the preparation of both hazardous and non-hazardous materials. A, it's used to prevent the introduction of microbes or unwanted debris that may cause a serious infection to occur. B, it includes hand hygiene and wearing personal protective equipment or PPE. 6, procedures to prepare IV admixtures. A, the flow hood again should be on for at least 30 minutes. Know this fact. Wear your PPE, personal protective equipment. Clean the laminar flow hood with 70% isopropyl alcohol or another suitable disinfectant. And then clean the pole to hang the IV bags. The sides of the hood by moving from the back to the front, because that's where the airflow goes. And again, know this method. They will actually ask you, how do you clean a laminar flow hood? So you want to use isopropyl alcohol, 70%, or ethyl alcohol. You want to clean the pole to hang the IV bags. You want to clean the sides of the hood. They're usually made of glass by moving from the back to the front. And then finally, the bottom of the hood by moving from side to side, from the back to the front. So again, when you're cleaning this hood, you want to clean side to side on the counter from the back to the front. Not from the front to the back to the front. Even when you're cleaning the sides, the back to the front. Remember that direction. Page 20. Page 20, top of the page. Collect supplies, check expiration dates and bags for leaks. Remove dust coverings before placing supplies in the hood, and use pre-sterilized needles, syringes, and filters. Also put a bunch of alcohol swabs in there. E, position supplies in the hood. Again, make sure it is at least 6 inches from the edge of the laminar flow hood workbench. F, sterilize punctured surfaces with an alcohol swab. For instance, the tops of the vials after the lid is popped off, right? The top of the vial, after you pop the lid, you want to swab it with an alcohol swab. Prevent coring by placing the vial on a flat surface and insert the needle into the rubber closure at a 45 to 60 degree angle. Use the downward pressure on the needle and move the needle to a 90 degree angle. Okay, so let me show you this. Let's say this is on the table. I don't think you can see it if I put it on the table. But let's say this vial is on the table. And then you have your needle, which is attached to a syringe. I wish I had a syringe, but let's say this is the syringe, right? What you want to do when you first come in, if you're going to reconstitute the vial, is you come in at a 45. You come in, see with the bevel, point the bevel down, and you come in at a 45 to 60 degree angle. Once you poke it, once you puncture it, then you move up to a 90 degree angle. And then you go down and you reconstitute. And you want to do that to prevent coring. You don't want any rubber pieces to fall inside of the vial. H, using vials with solutions. So you want to draw into the syringe a volume of air equal to the amount of volume being replaced. You want to penetrate the vial without coring. And you want to invert the vial upside down and pull back on the syringe to fill the syringe. So after you've reconstituted the drug, you insert the vial, you insert the syringe with the needle, and you pull back on the syringe to get all the fluid out. It's always easiest to inject air into the vial, cause some positive pressure. and then the solution will automatically come out of the vial and into the syringe. So, tap to bring air bubbles to the top of the syringe and then transfer the solution to the final container, such as your IV bag that you're preparing. I, vials with lyophilized powder. So determine the correct volume of diluent and then withdraw. The diluent will be the liquid that you're dissolving the powder with. Transfer the diluent into a vial containing the powder and remove more air from the vial than the amount of diluent injected. And then whirl the vial until the powder is dissolved, and then use a new syringe and needle and proceed as if using a vial with a solution. Using ampules, hold the ampule upright and tap it to ensure all liquid is in the bottom of the ampule. Wipe the neck of the ampule with an alcohol swab. Wrap gauze or alcohol swab around the neck and gently snap the neck away from yourself. I already showed you this. And then insert and use a filter needle or filter straw to withdraw, because remember, if there's any glass particles, we want to make sure it gets filtered. Hold the ampule downward at a 20-degree angle and then withdraw the solution with the filter syringe. Number 7, considerations in preparing chemotherapy medications. Page 21. A, we use the same aseptic technique used in preparing IV solutions, except for the following. Chemotherapy requires a vertical laminar flow hood or biological safety cabinet. Again, like I said earlier, today most pharmacies use a biological safety cabinet. They're also vertical laminar flow hoods. The biological safety cabinet is smaller than a horizontal laminar flow hood. It's small and it's vertical. It sits a little bit higher. Special chemotherapy clothing is worn whenever you compound chemotherapy medications. And the hands in a vertical hood should not be over the top of any needle, vial, or IV bag. Because remember, in a vertical flow hood, the air is coming from the top or bottom. So you don't want to have your hand like this, or resting with your hand over, because you're blocking the airflow that's going to go from the top to the bottom. In a horizontal flow hood, that's different, right? Because the air is coming this way, from back to forward. You don't want to put your hand in front of the vial. Okay. Considerations in preparing parenteral antineoplastics or anti-cancer drugs. The safety cabinet work surface should be covered with a plastic back absorbent paper, which is disposed of in a hazardous container after use. Personnel should wear approved gloves for chemotherapy products that are double gloved and a closed front surgical gown, closed in the front, with knit cuffs that are specially designed for handling chemotherapeutic agents. Contaminated gloves or outer gloves should be removed and replaced. If the skin comes in contact with anti-neoplastics, then the area should be washed with soap and water. Reconstituted vials should be vented to reduce the possibility of spraying and spillage. A sterile alcohol plugette should be wrapped around the needle and vial top during withdrawal of solution. Plugette is a name for alcohol swab. Okay. External surfaces of syringes and IV bags should be wiped clean of contamination. It's very rare that we see bottles these days. When using ampules, wrap the neck of the ampule with a sterile alcohol plugette to protect one's fingers from being cut by the glass. And syringes and IV bottles or bags should be properly identified and dated. Cautionary labels should be affixed to the outer bag of the container. Page 22. H. The safety cabinet should be wiped down with 70% alcohol on completion of compounding. Contaminated needles, syringes, and hazardous waste should be placed in a sharps container. And the sharps container usually is inside of the workbench, laminar workflow on top of the workbench. Disposable gowns, gloves, masks, head and shoe covers should be placed in red hazardous bags. Always wash your hands. And dispose of remaining anti-neoplastic agents according to federal and state regulations. All right, 9. Consideration. Now we're done with anti-neoplastics. consideration in preparing TPN or hyperalimentation solutions or hyperals. Please fill in. TPN is total parenteral nutrition. Total parenteral nutrition. Parenteral spelled, I have to close my eyes here, P-A-R-E-N as in Nancy, T-E-R-A-L. So a TPN normally contains 50% dextrose. You need the sugar for energy, for calories. 10% amino acids. You need proteins, so you don't go into negative nitrogen. And 20% fat or lipids. Aseptic technique is required because TPN is infused into the right atrium of the heart. TPN compounders have been developed that include a multi-channel pump for amino acids, dextrose, fats, and other additives that is connected to a personal computer. The computer assists in the calculations and drives the pump. And then micro-compounding pumps are used for the electrolytes and other additives. So if your hospital is a bigger hospital, they may invest in one of these machines. Otherwise, the pharmacy tech does everything. TPN and peripheral parenteral nutrition, or PPN, are pre-mixed from the manufacturer, but electrolytes, vitamins, and medications may be added to the nutrients at the pharmacy. 10. Compounding techniques for TPN solutions. Obviously, just like regular parenterals, it requires aseptic or sterile technique. A. Method 1. Amino acids and dextrose are mixed first, and then fat emulsion is added next, followed by the additives. In method 2, amino acids are added to the fat emulsion, and then dextrose is added next, followed by the additives. Page 23. Now, I want to say something here. If you remember in the PowerPoint slides in the lectures, there was a link. There was 4 links that I told you to take some time and look at each one. It takes, I forgot how long, I think it might be like almost an hour. It goes over IV aseptic technique. So if you want to get into a hospital, you need to know the basics of aseptic technique. You're going to be tested on it in this exam, but those videos, if you watch those videos before you actually listen to this video lecture, you'll know exactly what I'm talking about, because it's kind of hard to see something on paper here without envisioning what I'm talking about. So I really implore you, if you haven't watched those 4 links, those 4 videos on aseptic technique or sterile technique, to do so before you take the exam. Okay, method 3. Dextrose, amino acids, and fat emulsion are added simultaneously or at the same time while swirling and mixing. And then the additives are incorporated last. Examples of typical TPN additives include potassium chloride, potassium phosphate, calcium gluconate, magnesium sulfate, sodium phosphate, sodium chloride, MVI or multivitamins, multiple trace elements, and zinc. So you can see there's a lot of different additives that potentially can go into a bag. And then you also have to calculate how many mils of each that you need, because a lot of these would be like in grams or mill equivalents. 11. Considerations in preparing radiopharmaceuticals. Let's go over this real quick. Nuclear pharmacy is a highly specialized type of practice. I've never seen them ask a question about it in the exam, but you never know. So let's go over it. Radiopharmaceuticals may be diagnostic or therapeutic, and they may be oral, IV, or inhaled. The individual must wear a meter indicating the radioactive levels to which the individual is exposed. It's like having a Geiger counter on you. Quality control tests are performed to ensure the radiopharmaceutical is sterile, pyrogen-free, and pure. Proper handling of isotopes during preparation and disposal must be ensured. Radiopharmaceuticals have strict packaging requirements, including the use of special shipping containers. Usually it's like made of lead. Safety principles of time, distance, and shielding are observed, and special training must be completed if one is to work in a nuclear pharmacy. Page 24. Okay, so considerations in preparing reconstituted injectable and non-injectable medications. A. Reconstitution is a process of mixing a liquid and powder to form a suspension or solution. You get a lot of reconstitution that you have to do in the pharmacy. Here's antibiotic ceftazidime. You'll notice there's lyophilized powder in it, so you're going to have to reconstitute it. You're going to have to inject water into it to get it into solution or suspension. The solvent is the larger part of the solution. The solvent is the liquid. And the solute is the agent or ingredient used with the solvent. So the solute in this case is the lyophilized powder. Solution is the solvent plus the solute. And measure the solute and solvent or distilled water to be used. Add the solute to the solvent in small proportions, and then you mix thoroughly. And then you check for precipitation for solutions or changes in color. And then you add a new expiration date and time of day to the product bottle and affix a shake well auxiliary label. So again, the solvent is the larger part of the solution. The solute is the agent or ingredient used with the solvent, that's the powder. And the solution is the solvent plus the solute. So the solvent, again, would be like the water, right, if you're going to reconstitute. Or it could be normal saline, depending on what you're reconstituting. 13, component of a label for intravenous medication. So these are the components of a label for IV meds. The name of the pharmacy, the patient name, the date the medication was filled, ingredients with quantity of each in the IV, total quantity of IV, directions for usage, infusion rate, any special notes, expiration date, then it must be initialed by the technician who prepared it, and then finally the licensed pharmacist's initials. Page 25, let me take a sip here of tea. Okay, expiration date of repackaged drugs. Federal law mandates that the expiration date cannot exceed, write this in or type it in, 6 months. Federal law mandates that the expiration date cannot exceed 6 months and cannot exceed 25% of the remaining time on the manufacturer's original expiration date on the bulk container. 3.7. Non-sterile compounding processes. So we're in a different area now. 3.7 is non-sterile. We just talked about sterile compounding. Non-sterile is governed by USP 795. 797 covered aseptic or sterile technique. 797 covered sterile or aseptic technique. And USP 795 covers non-sterile. Non-sterile compounding processes encompass what we have discussed already in the outline above. It utilizes compounding techniques, which are special areas reserved in the pharmacy, just like an aseptic area. Equipment and supplies, safety such as personal protective equipment, and pharmaceutical calculations that must be accurate. That's why you have the pharmacist double check your work. Let's go through some definitions. Excipients. This is any substance added to a prescription to confer a suitable consistency or form of a drug. Excipients are also known as the inactive ingredients. So excipients are inactive ingredients. The active ingredient, remember I told you to remember that, that's the ingredient in the compound that exerts the actual wanted therapeutic or pharmacological effect on the body. 3, geometric dilution. This is the mixing of the active ingredient with the excipients. You start with the ingredient of which the smallest amount is needed, and then you double the portion by adding the rest of the ingredients in ascending order of quantity. Each addition should result in a doubled amount until all the ingredients are mixed in. And then this process ensures even distribution of the active ingredients throughout the final product. Okay, C. Dosage forms and basic guidelines. There are many types and forms. Page 26. Okay, so the top of page 26. 1. Capsules. So capsules, this is an oral dosage form and has an important role in drug delivery in that it is extremely versatile and offers a broad range of dosage options for patients. Capsules can be prepared by hand or with the capsule machine. The method used will depend on the quantity needed and the physical characteristics of the powders included in the formula. Sizes of capsules range from triple aught to 4. And remember, just like syringes or like needles, the larger the number, the smaller the capsule size. So the larger the number of the capsule size, the smaller the capsule. Know this fact because on the PTCE they'll say, which one of the following is the largest capsule? 0, 1, 3, or 4. So the answer would be 0. Or which is the smallest capsule? 0, 1, 2, or 3. Well, 3 will be the smallest, right? So, for example, a size 00 capsule is larger than a size 0. A size 3 is larger than a size 4. Tablets. A solid dosage form that can be administered orally, sublingually, vaginally, or as an implant under the skin. Compressed tablets made by pharmaceutical manufacturers are the most commonly prescribed dosage form. Powders. These are a solid dosage form made from a thoroughly blended mixture of one or more active ingredients and excipients. The excipients are the inactive ingredients. They may be either used internally, such as PO by mouth, or externally, which is topically, right? Lozenges and troches are both oral dosage forms. Troches is just another name for lozenge, that are placed in the mouth or in the buccal cavity or under the tongue and allowed to dissolve. They're usually meant to disintegrate over time, and the base is usually made out of sugar. They want to make it more palatable, so they make it sweet like you're eating a candy. Sticks. These are a unique dosage form used for topical application of local anesthetics, sunscreens, antivirals, antibiotics, and of course cosmetics. It is convenient and relatively stable and fairly easy to prepare. Page 27 at the top. Number 6 is suppositories, and this is a solid dosage form that is inserted either into the rectum or vagina. And the suppository melts and softens or dissolves at body temperature, thus allowing the absorption of the medication into the surrounding tissues. They're made in several sizes and shapes, depending on the application and the amount of drug to be delivered. 7, solutions. These are usually in water, in aqueous solution. It's a water-soluble chemical is dissolved in the water phase of the compound, and this may consist of just enough distilled or preserved water to dissolve the drug, or water may be as much as 50% of the final volume. After the drug is completely dissolved in water, the compounder may complete the compound by adding flavoring agents and bringing it to the final volume with the sweetening agents such as OraSweet, simple syrup, or Caro syrup. Simple syrup is just sugar and water. And then the patient usually shakes well, disperses it before taking the solution. Suspensions, you'll know suspensions as antibiotic suspensions. This is a liquid preparation that contains insoluble solid particles uniformly dispersed throughout the vehicle. A suspension must be shaken prior to administration to ensure that the proper dose is dispensed. Many liquid antibiotics are suspended in a suspension delivery system. 9 is emulsions. This is a liquid or semi-solid preparation that can be taken orally or applied topically. Emulsions are prepared whenever two immiscible, meaning not dissolvable in each other, liquids must be dispensed in the same preparation. Vinegar and oil is a good example of an emulsion. So an emulsifying agent is used to hold the two liquids together. And then one part is oil and then the other part is usually aqueous. Page 28. And then ointments, number 10. An ointment is a semi-solid preparation that is usually applied to the skin or to mucosal tissue. An ointment does not penetrate into the skin, but rather it just stays on top of the skin. Ointments should be soft and easily spread and should also be smooth in texture and not gritty. It's why we use an ointment mill to compound them. Common ointment bases used in compounding include Vaseline or white petrolatum, hydrophilic or water-loving petrolatum such as in Aquaphor, hydrous lanolin, and in PEG, which is polyethylene glycol. To ensure a smooth ointment, the particle size of a powder being incorporated into the base should be reduced to an impalpable form by what's called comminuting or triturating, which is the process of reducing the particle size to a fine powder. So this is usually achieved by using a Wedgwood or porcelain mortar and pestle. or by using a machine such as the ointment mill. You saw an ointment mill in one of the PowerPoint lectures. A. Trituration definition, know this, is the process of reducing the particle size of a substance by grinding, also known as comminuting. Pastes. These are stiff or very viscous ointments that do not melt or soften at room temperature. They are intended to be used as a protective covering over the areas where they are applied. Creams. Creams are a soft, opaque solid that is usually applied externally. Creams dissipate into the skin, healing the affected area from the inner layers of the dermis. Medications are usually suspended or dissolved in a water-soluble base when a cream is compounded. Cream bases available for compounding include vanishing cream base and HRT base, as well as some commercially prepared creams such as Cetaphil, Eucerin, and Lubriderm. And then gels. Gels are semi-solid systems consisting of suspensions made up of small inorganic particles or large organic molecules interpenetrated by a liquid. Gels are usually water-based preparations. Page 29. Ophthalmic, or eye. These are preparations for the eye, which may be in the form of a solution, a suspension, or an ointment. All forms must be sterile. It's going to the eye. And solutions must be clear and particulate-free. Are the ophthalmic dosage form most commonly prepared in compounding pharmacies. So, solutions. In addition to the active drug, pH buffers are added to maintain the pH of the product to make them non-irritating and compatible with tissues of the eye. Preservatives are also necessary when the ophthalmic preparation is intended for multiple use. They prevent contamination of the preparation from microbial growth. Then next is otic. We had eye, now we have ear. Otics are preparations are for the ear and are made in liquid, powder, or ointment form. Solutions and suspensions are instilled into the ear, whereas ointments are applied to the outside or external part of the ear. Otic preparations are generally used to treat local infections and pain associated with them. Other otic products are used to dissolve or remove blockages that can lead to infection. Now remember, in your SIG codes, ophthalmic, what is the SIG code for ophthalmic or eye? It starts with O, right? OD is right eye, OS is left eye, and OU is each eye. Remember O, just remember O for eye, not O for otic. The SIG code for otic, or for the ear, if you remember, starts with the A. AS is into the left ear, AD is the right ear, and AU is each ear. Think of A as auditory, or for ear. Okay, nasal preps. Number 16, these are preparations for nasal administration which may take the form of solutions, suspensions, gels, and ointments. So these preparations may be used locally or systemically depending on the nature of the drug and the vehicle that it's in. In addition to the active ingredient, AI, several excipients or non-active ingredients will most likely be used, and these can include vehicles, buffers, preservatives, and tonicity adjusting agents. Because nasal preparations are generally dispensed in multi-dose containers, it is necessary to include a preservative. Two common vehicles used for nasal solutions are sodium chloride, normal saline, which is what? 0.9%, and sterile water for injection. Okay, briefly here, when we're done, D, veterinary compounding. Let's go to page 30, last page. Veterinary compounding is usually done by compounding pharmacies that specialize in just compounding. Most compounding pharmacies, about 50% of their business is actually veterinary compounding. Veterinary compounding is one of the fastest growing areas of pharmaceutical compounding. It's very profitable if you can build a business based on veterinary compounding. Medication doses are usually calculated on the basis of milligram per kilogram of body weight. And because of the vast differences in the sizes and physiology of animals, this makes appropriate dosing nearly impossible when using manufactured products. So there's a good open void for manufacturing veterinary products. Two, the same principles used in compounding of human medications apply to veterinary compounding. Let's lend our fellow animals some respect here. Stability, solubility, drug availability, dosage form choices, cost effectiveness of drug sources, and quality of final products are all factors to be considered before attempting to compound drugs for animals. Okay, that's the end of 3.0 sterile and non-sterile compounding. I know it's a long one. Hopefully you pushed the pause button a few times as we got through this. This will be our longest lecture in the outline series. And good job, and we will see you in the next we will see you at the next lecture.